Good morning. This is Lorraine. I'm a nurse practitioner and I teach a diet program called the Dr. Gon's Diet of Hope, and it's an amazing thing and I want to teach it to the world if I can. I'm going to start by just trying to publish our seminar and get these concepts out onto video to promote and help support the patients who are already familiar with the system. So Dr. Gon's Diet of Hope was invented in Tucson, Arizona by Dr. Dietmar Gon and his amazing wife Liz. I was fortunate enough to work with them for about 2 years, teaching patients in Tucson every day, 5 days a week, and I saw upwards of 35 people a day teaching them this system, which we developed into a 6-week-long intensive where we provide weekly menus. We kind of simplify everything and make it work for folks. Our system helps people to lose 5 to 10% of their body weight in the first 6 weeks. And our biggest loser, Linda, has lost 240 pounds in our program. So the effectiveness for me is without question. And moreover, I've brought this program here to Hawaii, and I've been teaching patients on the Big Island with it for about 4 years. I have enrolled over about 150 people since the pandemic got started, and I have all the same results happening here in Hawaii. So why not expand this and teach it to more people? If you're a medical provider and you'd like to learn this program, you'd like to figure out some kind of way of helping your patients lose weight, believe me, this is a system that's portable and it's easy for you to learn. If you have the same passion that I do in helping people lose weight and really get healthy, not just take pills for everything. So what I'd like to do today is I'm walking around this amazing park here in Oahu. This is Ala Moana Beach Park, where people come to walk around and be active and get in the water, and it's really pretty. I thought, why not take a few minutes and record some of the videos that I've been promising patients. So Dr. Gon has been teaching what we call seminar for about 10 years, and I think since the pandemic he actually had to pause that program. So I'd like to put our seminar out onto the internet so that folks who are enrolled, or maybe their family members and friends, can get interested and involved in what we're doing. And the why. The seminar is more about why we developed this concept and how we kind of got it going. And I've expanded some of the seminar to include the reasons that I've been able to do it here in Hawaii in a kind of a different format. I found my home in sleep medicine, and I think that it makes a whole lot of sense to pay attention to your sleep. There's Diamond Head. While you're trying to lose weight, because honestly, sleep is number one. If you're not sleeping well, there's a good chance that you could be gaining weight or having a hard time losing it. So let's start there. All day long in my current position at Honolulu Neuroscience Clinic, where I work with Dr. Michael Russo, amazing doctor who's spent 30 years at Walter Reed as a military veteran and very passionate and compassionate for his patients, and has enabled me to bring this program into his clinic. And we're seeing results with patients who are challenged, who have serious neurologic conditions, and they're getting better by learning how to eat better. And it's really awesome. I love what I do. So let's start there. Let's start with sleep. The first thing we screen for, and by the way, if you want to just enroll with me, you're hearing this already and you're kind of getting into it, I'm going to have links below so that if you are on the Big Island, you want to come see me, you can find our forms, you can figure out how to become my patient. We do require a referral from your primary care provider because, of course, they need to know what's going on with you. And you can just ask them to enroll you in the Diet of Hope, or for weight loss, or for sleep problems, if you know about them. And I think one of the sleep conditions that many of us are dealing with that we may not even be aware of is called obstructive sleep apnea. And a good portion of my day I spend explaining this condition to people. So why not explain it to a broader audience? Sleep apnea comes from usually structures in the back of the throat. It could be an enlarged tongue, it could be enlarged tonsils, or with age, the top of our throat, the roof of the mouth, the uvula, that thing that hangs down in the back, tends to descend and get a little bit lower. And just as the skin here in the neck can get a little bit wobblier as we get older, the same processes are happening on the inside of your mouth. And as this occurs, the tongue typically gets stuck in the back of the throat while you're asleep, causing impairments in your breathing. In other words, you stop breathing when you're sleeping. Not a good thing. That stresses out your nervous system and literally can be the cause of weight gain or prevent weight loss. Maybe the techniques that you've tried in the past, like folks here, walking, getting active, maybe these things aren't working for you anymore. For some reason you lost 20 pounds doing it before, but all of a sudden it's not happening. This could be sleep apnea at work. Apnea typically makes it far easier to gain weight and much harder to lose it, and can lead to those conditions that we know to be associated with obesity, like hypertension, strokes, heart problems, acid reflux, insomnia, waking up a lot to pee, like 8-9 times a night. You know, I love what I do because sleep to me is so essential, and it's something that we all do, something that we all can, really connect with. Now, many of my apnea patients have no idea that they're doing this. Maybe their spouse knows, maybe they live alone, and they have no way of knowing. The best thing for everybody to think about doing if you're struggling with your weight is get a sleep study. This is the way we can know for sure if sleep apnea is a component in what's causing you to gain weight. How rude to go to sleep and gain weight. There's Diamond Head again. So if we can fix your sleep condition, in some cases, the weight starts melting off. I've seen patients who come back for follow-up a month after we start treating their apnea, and they've lost 10 pounds without doing anything differently. That's how powerful sleep apnea can be. So the first thing we're always going to do is screen for that condition, because there's no sense having your sleep slow you down. And as I say, apnea can be a deadly condition. In fact, my dad died of it at a young age. He was 36 years old. Yep, 36. So I've kind of had this thing hanging over my head for a long time, and I've had to be focused on my health, from like being a teenager. The thought of, why did that happen to my dad has been in my head. And I think that the Diet of Hope really stemmed from another child of Dr. Gahn's wife, Liz, is one of the founders of this program. And she comes from a family of diabetics. Every adult in her family had the disease, including her mom, who died of major complications of diabetes. And I think when you're the kid, and that was your parent, your loved one, and you know that you've got those same genes inside you, it motivates you. It tends to, do a little bit more than it does to the average person. And it certainly has done that in Tucson. The Diet of Hope has blossomed into 2 clinics. Prior to the pandemic, they used to see upwards of 200 patients a day. Ooh, it's getting darker over here. Let me go this way. 200 patients a day, have treated over 20,000 people. And I'm so grateful to have spent 2 years there, because it really taught me the power of nutrition. It taught me the power of changing my thoughts, and I thought I ate pretty healthy by the time I got there. I think we all have some really ingrained beliefs when it comes to dieting and what's healthy, what we're supposed to eat. And I find it kind of interesting, amazing really, that we seem to be the only animal on the planet that no longer is too sure about what we're supposed to eat. How did this happen to us? You hear those birds, they're not curious about what they're supposed to eat this morning. They know exactly what they're supposed to do. But we, as Americans in particular, seem to be struggling on this. Honestly, we're not nailing it. Things are not looking good for many of us. And the pandemic, I think, has made it a lot harder. So, the big concepts that we want to kind of drive home to people with seminar is really to talk more about sugar. Now, I've got some slides I'm going to be slipping into the middle of this talk here to really drive home the importance of paying attention to sugar in your diet, and the importance of remaining humble about that concept as well, because You know, there's hidden sugars, there's foods that we've been told for many years are healthy and maybe they're not, for weight loss, okay? And this is why we've, evolved our system into a 3-step process where patients start off in phase 1. Phase 1 involves those first 6 weekly visits. And we found that the coming into the clinic to weigh in is an essential part of jump-starting this change in eating, this change in lifestyle. You need accountability to do this. Most of us do. Even people who've been successful at dieting in the past may need, an extra kick in the butt at some point. And that kick in the butt comes from accountability. So whether you can come be my patient or make it to the Tucson Center, there's also a doctor in San Carlos, Mexico, and another one in Germany who have learned this method. If you're in those areas, please go learn from somebody who's experienced with it. If you're on your own trying to figure out how to diet, what to do, if the pandemic's got you putting on some COVID 20 pounds, those are the 20 pounds you've gained since COVID, and you're trying to figure out how to lose it, the first thing I would encourage you to do is find a way to become accountable to someone, to yourself, honestly, ultimately. You won't get there without accountability. And so the weekly visits, people come in for the weigh-ins, and we provide them with menus that we've developed and curated over many years. Our system is well honed, it's pretty simple, but it works. It's been effective for 20,000 people. So we start there, that's phase 1. In the 6 weeks, you get time to integrate the ideas, figure out what to shop for, what to make, and you get the positive feedback, the positive experience of coming to the doctor and getting healthier. I would say by week 2 and 3, patients, typically drop quite a bit of fluid, and this tends to stabilize blood pressures and blood sugars. Patients frequently come off of medications when they join our program. And that is what my role, my nurse practitioner role, is for, to advise people how to decrease their medications as they're successfully losing weight. And these changes happen quickly. They don't take 50 pounds to change. In some cases, within days, people come off of insulin. And I know this may sound kind of crazy. Why would we, be popularizing the concept of putting people on insulin if it was that easy to get them off? Well, I think it's not easy anymore. It's really complicated to go shopping, to know what to buy, to know what to eat, to go out to eat, and know how to stay on track. There are many, many things that screw us up. And I think this is one of the reasons why we need more programs like this that simplify things for people. So as I say, back to sugar. So phase 1. Phase 2, we start reintroducing some foods that you love. We're not taking away everything you love forever. That is also not realistic. If you've been on highly restrictive diets in the past, I'm here to tell you to stop doing that to your body. You need variety. You need food from your, upbringing. You need things that you love. Life is short and food is to be loved. The system that we teach is about loving food in such a way that it can love you back. And so that ultimately you can get to maintenance, to your goal weight, really, all the way there. And we help advise patients, especially in the beginning, as to some realistic goal setting. We base those goals on BMI charts. BMI charts stemmed from the insurance industry. I have to be honest with you, there's not too much that I really like about insurance companies, except for having insurance. It's important, right? But I think when they get their heads into what we do here in medicine, it's usually problematic. But I trust them with this one thing, and that's BMI charts, because they were actually the ones who identified it. Insurance companies realize that once a person reaches a certain height and weight, they typically tend to develop all of these diseases. And that is all of the diseases that we treat. Most of them are associated with being overweight, whether it's knee pain, acid reflux, or all those things that go with sleep apnea. hypertension, raising your blood sugar, strokes, heart attacks, etc. Weight is the problem. Really it is. So why aren't we addressing it more? Well, back to those insurance companies. Maybe some of them are listening at this point and questioning how they're going to reduce their costs post-pandemic. Well, I'm here to tell you the number one way to do it is to encourage subscribers to lose weight, because it's actually pretty easy, pretty cheap. I don't say easy, it's cheaper. It's way cheaper to put people through their paces in my kind of program, or maybe someone else's, particularly if it's a sustainable method that people are going to maintain. When we help guide people to maintenance, we really mean that, maintenance. We want you to be assured at the end of it that you know how to maintain the weight loss. I really do think many people come into, all of this dieting very confused about what dieting is for. And I think we've gotten to where we're perpetually either on a diet or just letting it go. And you know what that means. That means gaining. So, how's about something different? How's about a slow and steady weight loss with the goal of knowing how to really keep it off? And I've counseled thousands of people on this. And when they listen to me, it works. It really does. Moreover, I've been practicing these methods myself for about 7 years. I just turned 49. Don't I look good? And I feel good. And I've been through the ringer in the last 10 years. And I'm really grateful personally to be indoctrinated into these methods so that I can keep myself and my family healthy as well. So we're here to help you learn how to do it for real and to really be able to enjoy some of the foods that you love, but still, stick to your goals and not have to wind up on pills and insulin as you get older. Or if you're already there, how to reel it back. Yep. So where was I?